This presentation is about chronic Dacryocystitis. Chronic Dacryocystitis is a disease of the lacrimal apparatus. And to be more specific, it's an inflammation of the lacrimal sac. I will start with the etiology, epidemiology, and risk factors. It's due to pneumococci, staphylococci, pseudomonas, or anaerobes. Chronic Dacryocystitis develops due to a stenosis of the canalis lacrimalis, which consequently leads to stasis and therefore bacterial settlement. Usually, adults greater than 40 years of age may be affected. And this disease is seen more commonly in females and Caucasians. Risk factors include nasal septum deviation, rhinitis. It can also be a consequence of trauma and neoplasms, systemic diseases, and medications. Clinical features include pain, erythema and edema, epephora, which is an increased tear production. Another clinical feature is the secretion of mucus or pus-like fluid. Furthermore, changes in visual acuity and additionally pain with extraocular movement can be observed. Diagnostic procedures cover patient history, physical examination, blood test for indication of an inflammation, serological testing to check for systemic conditions, CT scans in case of trauma, Dacryocystography when anatomical anomalies are expected, and nasal endoscopy. Differential diagnosis can be acute ethmoid sinusitis, infected sebaceous cysts, cellulitis, eyelid ectropion, puncture ectropion, allergic rhinitis, and lacrimal sac or sinonasal tumor. Treatment comprises warm fomentations, local and systemic antibiotics, overpressure irrigation. Also, punctuation and draining of the fluid at the abscess formation site. In case of canalis lacrimalis stenosis, dacryocystourinostomy is performed. Dacryocystourinostom is the creation of a connection from the sulcus lacrimalis straight to the nose to facilitate the drainage. The prognosis is mostly positive, but it is required to go to the ophthalmologist as soon as possible. Complications are lacrimal fistula, lacrimal sac abscess, meningitis, cavernous sinus thrombosis, and vision loss. In this slide you can see the literature we used. Thank you for listening.